So there are a few considerations to think about when deciding what your unit would want to use or what you think is the best for you or your patient. So the cost of the incentive spirometer, I know that was brought up in a few articles. It might be too expensive for the hospital to be able to afford or be able to afford for every patient. The patient's educational level as well, that's another consideration because they might not be able to understand the purpose of the breathing or the spirometer when you're telling them. And the compliance is also a consideration because even though you do teach the patient, they still might not listen and do it as many times as they're supposed to or even do it at all. The incentive spirometer should also be within reach, and sometimes it's not, and the patient might not be able to get out of bed and get it or reach over to wherever it is and get it, so then they're not going to be able to use it. The patient's ability to correctly perform these techniques as well, that's another consideration. That goes along with the education, so if they're educated properly, they should be able to do it, but if they do have some type of inability to perform these techniques, they may need the nurse's help. And another consideration going off of that is the nurse's availability to provide the necessary education or to help them if they need help with using the spirometer or breathing. Timing of when to use the incentive spirometer and the diaphragmatic breathing is also another consideration because some patients have a lot of time off the unit with dialysis or chemo or whatever it have be. They might not be on the unit a lot, and they might sleep the rest of the day when they get on the unit. So they might just not feel like using it because they don't have a lot of extra time, and that's not what they want to do with their extra time. So there are a lot of things to consider with looking at these, and those are just the main ones.